Hello, everyone, and welcome to the show. This is Create with Franz, and today we are going to talk about fertility, IVF, and what emotional blocks we might have to overcome in order to have and hold a precious baby. And we do this with a specialist today. So, welcome, Esther Lawton, to the show. Hello.
Hello, lovely to see you and speak with you.
Yes. So, Esther, yoga teacher, nurse, RTTer. What else do you do? It's just incredible. You know all about health and women's health as well.
Yeah, I have been a homeopath for over 25 years. I'm very proud to say that I have 4 lovely children, but I did have a gap with my children when I struggled to conceive myself. And then my youngest daughter wasn't well, so that's how I got into homeopathy. And then I discovered RTT, and I was working for the NHS in fertility clinics. So I thought I would fuse everything that I have together and become a clinical hypnotherapist, thanks to Marissa Pearce. So.
Excellent. And Marisa is such a gem. And we put together all this because we know that being able to have a baby, you ladies listening, just listen carefully, is not just about what your body is able to do, but what your mind is able to do. And a lot about gut flora, emotional beliefs, general health, diet. Is so much into this very complex thing. And as we were talking about before the episode started, there are things that might make us believe that we are unable to have babies. And so because of that, we are not ready to actually conceive. How does that work? What's the problem with that? It's not very easy then to have babies?
It isn't if you don't realize that in the womb your mother underwent quite a traumatic pregnancy, and you've actually taken on the trauma in utero and not realize this. I've had cases where significantly you wouldn't, their subconscious, if you knew what the problem was in your conscious mind, it would be easy. But, these patients, they don't. And so subconsciously under hypnosis, they're able to go back and retrieve and become more empowered by finding the story of the belief that they adopted that was never theirs to have. Hearing things that were said when their mother was under stress or struggling as a single parent, that parenthood was a difficult thing, that it was an awful thing, that being a mother was the worst job in the world. So they've taken on these beliefs, and they've usually either to protect themselves or punish themselves. But of course, they don't realize it until they unpack it with support, really.
So that's the thing. So do you see many people with this problem, obviously, especially older women? Do you think they come at 30, 35, they're desperate to have a child, it's not happening, and they're kind of like, oh my gosh, what do I do now? My biological clock is ticking. What do they tell you?
I have had younger clients as well. I think when you decide that you want to try for a family and it doesn't happen, automatically, I think as a woman, you think, there must be a problem with me. So you go around correcting it. Most of the women and couples that I work with are very, very successful. They've always had a strategy for being high achievers and achieved everything. But this is the one thing that they really cannot seem to complete. So many of them will either come to me with high levels of anxiety, and that's easily remedied. And usually patients under 30, I can eat, they're pregnant literally their next cycle, because it's literally been an easy thing. For that particular case, this lady had been trying literally for a few months and was just very anxious it wasn't going to happen, and basically had an imprint from her mother about, it's not a good job to do, it's a difficult job and you won't be able to do it. Not everyone can be a mother. And so she just carried that and she hadn't realized it. And then I think that her next cycle, she said, I can't believe it. I have a baby. And she has a bouncing, beautiful baby boy now. So yeah, there we go. So it just really depends for each individual. And then I've had other cases where people have miscarried, and that's been a very traumatizing experience, and they haven't been able to grieve. So they carry that grief with them, and then that's impacted on a belief as well. So they need to almost make their peace with that little soul, that little baby that they carried for, you know, for that period of time, that came into their body and had a home with them, that then left them. And they need to understand that, and they need to have a conversation with that child that they lost and acknowledge that child, because that child will always have an imprint in their heart space, always. So when I think it's just very difficult when you work with clinicians, and I have the greatest respect because I work with them myself, I think you need to look at the holistic side to somebody as an individual, because everyone will express and need to express their grief so very differently. And I think for this woman, it was just all consuming. She'd had counselling, and everyone thought, you know, it's been that time, so just keep dealing with it. And she had so much that she needed to release because she'd never had a conversation with that little soul that she carried.
Yes.
And it, you know, and that's quite a simple, yeah.
No, that's okay. Carry on. Sorry.
And just to release, just to release that trauma and to release that pain. And I would say most of my patients go into it thinking, you know, they're very systematic, and they'll go, right, well, this is it, hypnosis, doing it. And then they never know. I mean, that's the beauty of it, and the power of it is you don't know what you're going to, you know, unpack. And everyone says, I didn't know I felt like that. I didn't know that that was there. But they do feel an enormous weight off their shoulders. I had another client who was very traumatized by something that was said to her by members of the family around her ability to be a good mother. And that was when she was much younger, because of her lifestyle and the choices that she made then. And, you know, all these judgments were said to her, and they're quite damning. You know, words are such harsh, painful things, and you can't erase them. And if things are written down, you know, it just carries so much weight. Yeah. And she too managed to conceive, and she has a beautiful baby girl now. So, you know, it's really interesting, and it's lovely to when they come back to me and say, I'm pregnant, you know, and I get a little scan picture, and then I get a picture of this beautiful bouncing baby. It is lovely, and it's, you know, that's why we do the work, really, because it does impact and improve people's lives and help give them the thing that they want the most, really. So that, coupled with couples with IVF, yes, it will work, but then I see a lot of people who are on this is their last round. And the language in IVF and used in clinics, and I've worked in several clinics, it can be so harsh sometimes. We're talking about rounds, you know, it sounds like you're in a boxing ring, and cycles. And you know, I'm part of an IVF support group, and the language that the ladies are using, and people are hanging on to threads of, you know, pineapple socks on the day, and having a McDonald's, and, you know, drinking pomegranate juice, and literally almost hanging upside down. And it's sad, because they're getting, I don't know, you can see the vulnerability there, but the language that's used by some of the ladies is, oh, another injection. Well, you know, you need to think about it. If you're looking forward to IVF and this is what you've got, and then you're dreading these injections and you're hating every minute of it, you're almost, you know, giving mixed messages to your mind. You know, you want this thing, but equally this, having the pathway to it is just so horrific for you. Your mind is going, well, you don't want that, do you? Because you're hating it and it's hurting you and you don't like it. So there's this dichotomy of emotions going on. And I don't think people realize that you know, the language that you use you've got to be careful what you're saying and what it really means. And I think, you know, there isn't the time in certain clinics. I think there was a good study done by Harvard where some ladies had hypnosis prior to going into IVF, and the cohort that had hypnosis had a 50% increase in successful outcomes, as opposed to the cohort that did not have hypnosis prior to IVF. So it goes down to, you know, tell yourself a better lie. You know, the stories that you tell, it's like going to your wardrobe in the morning. You choose your outfit for the day. You can choose your emotional outfit. So go to your emotional wardrobe and pick what you need for that day, you know, to carry you through. Lots of people are in so much pain, they can't even consider talking about marking 2 lines on a pregnancy testing pen, because to do that is too painful, because they want it, they think it will happen, but they don't really deserve it. And you know, when I work with people, I go through 7 different things about allowing, trusting, deserving, how confident, how safe does it feel, and I talk about these 7 areas and I score them out of 10 with clients just to see, and some of them are so low, so we can, before the session, I can more or less go to where I think the block is, which really helps, you know, because that's what we want when we're manifesting. So we're speeding up the manifesting process, because I genuinely don't think anybody, you know, the source, the oneness, whatever you want to call it, even if you don't believe in anything, I don't think anyone deserves to not have what they really want.
Absolutely. On that, I really have to add, I really believe there is a God that made us. We exist, and we are here to have happiness. We're not here to be punished. And so
No.
everyone has to understand we have this huge potential to live a good life, even if we have disease and death, and there is so much violence in the world, but there's also goodness. And so if we go with a good expectation to do the best we can, knowing we have this huge potential, some people will call it divine potential, eternal potential, we have it, it's inside us. And, some people even believe that children have chosen to come to our family before we came here. There are lots of beliefs here. And I'm not here to tell you what to believe, but certainly it empowers me to know that I am entitled to have a life, to create a life, and to make decisions, and to choose in which direction I can go within my situation. And that's beautiful to know. And when we use words, well, a lot of people, not podcast listeners, because 200 episodes, they will know by now, the words have power. So the words that we use can literally create our reality, because they come from a thought. And the thought is a real electrical vibration, something going on in our brain. And our brain cannot tell the difference between what is real and what is not real. In fact, you may be crying when you're watching a movie with Nicholas Sparks stories and whatever, and you might be terrified when you see a horror movie, despite them being just pixels. Why? Because the brain cannot tell the difference. So if our brain is constantly churning out negative thoughts that, oh, I'm too old to have a baby. I mean, if you're 80, okay. But I already had 3 miscarriages. I can never conceive. It's going to be too bad. I'm going to fail. It's going to be too painful. How are we going to have a good experience? Because we are just setting up the whole place for failure. So it's...
You've already set yourself up. And I think that's the benefit of having homeopathy. I think when I can give people homeopathy alongside their IVF, or even if they're not on IVF, it does really help. It definitely, I think, because it feels that they're doing something as well and they're being active, but I think energetically it helps. Certainly acupuncture definitely helps alongside trying to conceive, but that's the same thing when all we're doing is moving energy through the body. You know, it comes from our feet out through the crown of our head and down and out, and the same inwards and out. So there's, if you embrace all the things, the body is just such a remarkable being, really, and so is everything around us. We've got to heal, so we really can heal ourselves if we're, I suppose, courageous enough. And it does take courage to come forward and to seek help and support, because I think, people are given, it takes a year before you will even be, through the NHS, and it is a lottery. And depending which area of the countryside you live in the UK, you might get 2 chances, you might get 1 chance, and then you can be waiting. I've met some people who have been 10 years in a system, and and going and spent an awful lot of money. I mean, people have sold cars, they've second mortgaged their homes, and they've lost their relationship through trying to conceive. And I think that's purely because they've probably not had the right support through their journey. And they've, no one's really asked the right questions to them. It's treated as, if you've got low AMH, label, and it is label, and you're that age, label, and your weight is label, and you've got this, then that's your option, and your only option is this. It's like the diagnosis of polycystic ovaries. I know women are told, well, you're going to struggle when it comes to conceiving because it's going to be difficult for you. Why would you need to, you might argue a case for informing a patient, but actually, when you say that, that's quite a detrimental and very disempowering statement to give to a young woman. The same with endometriosis. These things can easily be sorted out with homeopathic remedies. And I've treated a lady with stage 4 endometriosis. And they were really quite bad adhesions to her bowel. And it's taken about 4 months, but things have significantly improved for her in her cycles. So, it's that never say never. And I think as much as we can respect, conventional medicine or allopathic medicine, we must be open-minded to all sorts of other forms of therapies to help individuals if we're really going to be holistic practitioners. There's never a one hat fits all in anything in life, ever.
Yes, these are very wise words. And if you think about a century ago, people would just have children, they will die at birth, or they will miscarry. We have no idea. There was so much infection. And, I do a lot of indexing, genealogy, and I see all these birth records and things, and the children would just die just like that, very young. It was normal to lose all these babies. And nowadays we have so much technology and advancement, we think we're better, but we're still looking in compartments, because in hospital you have the maternity department there, and the gastroenterology department there on the other side. But maybe the reason why you're not conceiving is because your gut flora is wrong, and that's in another department. So people need to talk together.
Yeah, who've had SIBO, and they've no one's looked at their gut bacteria, and that's all been wrong. And then when that's been addressed and that's been treated, then they're able to conceive. So, you've got to look at various other little symptoms around your body, because your body will produce symptoms to bring it to your awareness. So you either think, oh, well, I've always had that for years, it's fine. But your body will find a valve to let, anxiety or pressure or stresses or bacteria or pockets will always find a way out,
Yes.
which you may not be aware of. So, that pain in your jaw or that earache, or, something that you think is just a bit of IBS or a bit of Crohn's, may not be. So it's always worth thinking, oh, maybe I should see a nutritionalist, maybe I should see a homeopath, maybe I should look at this differently, maybe I should get tested for SIBO and start thinking about how I can induce probiotics into my daily routine, really.
Yes, because of course nutrition is so important. And you know what? That reminds me of a book I was reading a couple of years ago. I still probably have it. And it was about losing weight or gaining weight using your mind. And there were all sorts of emotional blocks that were described from his psychotherapist. One story was very particular because he talked about a lady who could never conceive. And she would just put on weight and put on weight, but she couldn't conceive. And the doctor said, well, you're healthy. We don't know why you can't conceive. And it turned out after all this, I'm going to cut this short, that she had this deeply held inner belief that having children would have ruined her life, because her mom had something like 8 or 9 kids. And she always felt neglected because her mom was so busy looking after everyone. And deep inside herself, when she was young, she went into hypnosis and she said, oh, I never want to be a mom, because this is what happened to you. You don't get loved, you're going to be neglected, etc. So her body has said, well, you know what? I'm going to help you. I'm going to help you to put on so much weight that you can hardly move. and it's going to make it really hard for you to get pregnant. So you're never going to have to suffer like that. And of course, when she had the therapy, she was able to overcome this. But isn't it incredible just listening to our mind and to those beliefs? So eye-opening, isn't it?
It is really interesting. I've had cases where they can remember being in their cot, put in their cot because mum was at her wit's end. Other cases where dad, that the husband has cheated, and that's been a result of having a family. And that's what the mother has told the child, is this wouldn't have happened if I hadn't had you, and I hadn't been so you carry that, and then there's this subconscious belief that if I get pregnant, what will happen to me? Will my partner reject me? Will he cheat? Will he? Because that's what I heard. That's the story, that's the belief that I think could be happening, and I don't want that to happen. I want to be in my relationship. So
Yes. But can I pick up on that? Can I pick up on that? Because you know what? If you look now between Instagram, social media, and AI images, a woman is supposed to give birth like the Princess of Wales, and within days she's out with a completely flat, size 8 body, slender, while a normal woman is not like that. She might have floppy stuff everywhere for months, if not for years, because she simply won't have the time to exercise or anything because she's very busy. She's not sleeping. She's stressed out, the cortisol is high, and she has to shed that little bit of weight that comes naturally when you are expecting a baby. So we have this really high expectation to look like that. And a lot of partners or husbands are like that. They're looking at the young woman they married, and now, oh, you are now with different shape. You're no longer the little 15-year-old looking person. So they start looking somewhere else. So we are stuck between, how do you say, the two stones, and I can't remember what's the English thing, but
rock and
a
a
stone,
hard
a rock and a hard
as a
place.
woman, I think, it is, because
you can win.
To be all glamorous, but at the same time, and I suppose that's that thing. I've had couples who maybe shouldn't probably be together, and as soon as they've left that partner, they've got pregnant naturally with the next partner. So, if I think that's also inherently, if you don't have a good relationship and your partner doesn't really want to conceive, but they're saying, yes, let's try, but they're not feeling it, and you're not feeling it. But it's like that elephant in the room, like, I think it, and you're picking up on it, but it's not really happening. I had a lady whose husband always seemed to be working away, never able to be around at the time that she was ovulating. And it's like, okay, well, this is interesting. And it was just unpacking that. And then it was more or less kind of opening up what was happening in the dynamic in their relationship. And as soon as that changed and she's with a different partner, she successfully has a baby now. And, it wouldn't have been right with that person. And she, it's so, I think you have to look at every aspect there. It's financial, it's your past trauma, it's your current relationship. And ultimately, it's down to, what do you want? Because if you don't really want it and you don't really believe it, then how are you going to bring it to you?
Absolutely.
Mm.
So important. And, one of my friends was like that for many years. She was like 10 years with a partner. They got married and children were not coming. They were not coming. They were not coming. She was more and more tense, and he felt more and more distant. And then he went off with somebody else and had a baby with somebody else. And deep inside, she always knew, yeah, the baby didn't come because my body knew he was going to go. Because you could feel this detachment, And now she's past 50, so she won't have more kids probably. But it was interesting that her body refused to give birth because the body felt there was no father that was going to be there, And it's incredible. And women have an intuition.
A lot. And I think quite often it's when we shut our intuition down, it's when we get in our heads and we're not working with our hearts, that's when there's this big power struggle going on, because we need to connect into our heart space. You know, that's where the wisdom is. But everybody, we all apply our heads to logic and reason. So, you know, it's like, yeah, the two dogs, isn't it? The Chinese proverb, the two dogs that need feeding, you know, which one will you feed first?
Yeah, the one they want to live the longest.
Yeah.
You feed that one.
And also, I was going to go back when we all went through COVID. We could see that COVID affected fertility significantly. Certainly for men, their sperm counts were significantly reduced for about 3 months. Yeah,
Interesting.
yeah.
So
So,
what's the
so
conclusion on that?
at the moment, I mean, it'd be interesting to see some of the studies that come out, but we then were waiting. It was taking about 12 weeks when patients had contracted COVID, having gone through COVID, for their sperm count to come back up to normal levels. And these were people who previously, when we had tested them, had very good high levels of sperm, very motile sperm, good numbers, but then they significantly declined during COVID.
Incredible. Right, 3 minutes left. So the tips for the people who are listening to this episode and they're like, we really would like a baby. So first of all, being aware of your health, your mental health, any trauma, anything, resentment, something that you haven't healed. Yeah.
Back to your childhood. Think back to your childhood, conversations that maybe your mum or parents or auntie had around you or around your siblings, messages that, you know, were frequently coming through to you, and just jot them down, you know, journal, write things down is a big thing, and get it out there and the feelings associated with that, really.
Yeah. And if you cannot cope with it and it's becoming difficult, it make you cry, you need a therapist. That's where you need to go and unpack this, because your baby deserves to come to the world to a mom that it's there and ready to.
Yeah, it wants baby, you know, your energetic baby wants to come forward to you, but you have to create that space for that baby to come into you.
I like that. We have to create the space. So that's
Yeah.
good. So you have this emotional part. Then of course we have a health, because we want to be healthy. So if we have to lose weight, if you have to take some probiotics, improve our diet and improve our stamina, that's all good, isn't it? So we are healthier, we are much more able to cope. And the last tip, let's do the last tip and then we go. What else can we say to a woman that is trying to conceive and it's not happening yet and is done with 2 things already?
Don't tell her relax. Don't tell her to relax. But you know, that's the most irritating thing I think you can say to somebody is, oh, if you just relax. It isn't that simple. But I would definitely say to them, consider looking at some apps and really going deeper into their mindset and the words that they tell themselves when they're having that conversation with themselves. When, you know, the negative parrot is sat there. I mean, we wouldn't have a friend that put us down all the time and said this, you know, we wouldn't have a friend like that in our lives. So why do we let that voice in our heads have, you know, the volume goes up? So you need to turn that volume knob down and connect with your humanity. Give yourself the amount of love that you would give other people, give to yourself. That would be my top tip. Look at where you're nurturing yourself, and actually write on the back of your phone, what is the most loving thing I can do for myself today? And make sure that you do something loving for yourself. Because I think it's very easy as a woman, and especially if you're a high flying, high achieving woman, to be giving. And remember, always keep that last match in the box for yourself to strike, because I think you can feel very depleted through your fertility journey and exhausted by all these different bits of information coming to you. Don't let anyone tell you or give you a label. Don't let your life and your fertility journey be defined by a label or a diagnosis, please.
Excellent. There is no better final ending for this podcast with this incredible thing with 30 seconds to go. So thank you, Esther Lawton, for being with us, nurse, homeopath, yoga teacher, and expert in IVF and fertility and all sorts and mindfulness. And so ask any questions click share, subscribe, and thank you for being with us today. Thank you, everyone, and see you all next week. Take care. Bye-bye.
Bye.